What is an epidural? This video is for patient information only and does not constitute medical advice or training for insertion or maintenance of epidural analgesia or anaesthesia. So why should you listen to my video? I'm a practicing consultant obstetric anaesthetist in the UK with over 10 years experience at consultant or attending level. So, there are many forms of drug-based pain relief that you can use in labour in the United Kingdom, going from least effective all the way up to the most effective. Least effective are things like paracetamol. In the middle are things like intramuscular opioids such as pethidine, diamorphine and morphine. Epidurals are the most effective mode of pain relief that's based on drugs. A doctor, who is a specialist called an anaesthetist or anaesthesiologist, is the person who inserts an epidural. They will come along and they will explain to you the benefits and risks of an epidural in a process called consent. They'll also ask you a little bit about yourself and explain the procedure. And this process of explaining and consent will take somewhere between 5 and 10 minutes depending on your history or questions. The risks that they discuss: around 1 in 100 people develop a headache after an epidural, which can be severe. Some people develop an itch with one of the two drugs that's in the epidural mixture. The epidural itself has a failure rate, and this is likely to be about 1 in 10 people where the epidural doesn't succeed a satisfactory level of pain relief. Also, over time, the local anaesthetic can make the legs heavy and can reduce the feeling to your bladder, meaning it's harder to pass urine. Sometimes this means a catheter needs to be placed in your bladder to help you pass urine during labour. Instrumental deliveries are associated with epidurals, and this is things like forceps deliveries, Kiwis and Von-2s. This is a thing that can be discussed by your anaesthetist if you wish. Epidurals can also cause low blood pressure, and therefore anytime you receive some of the drug, we will measure your blood pressure regularly. This thing goes quite tight and can be a bit uncomfortable sometimes. Very rarely, there is a risk of introducing infection or causing bleeding around the central nervous system because of how an epidural is inserted. This risk has been studied very extensively in the UK in a thing called the NAP3 study, and has been shown to cause long-lasting damage in a very, very rare 1 in around 100,000 people, which is reassuring. Once the anaesthetist has gone through all the risks, they will set up and perform the procedure. This will take about 20 minutes, depending on how easy or difficult it is to get you in the right position and explain to you what we want to do. It will become effective over somewhere between 30 and 60 minutes, so it's not an instantaneous effect. If you look at this cat, it has a very curved back, and this is a position that we will explain to you to get into to try and help your back spaces open up for insertion of the epidural. The equipment that we use for putting epidurals in are a local anaesthetic, a very small needle for putting the local anaesthetic in, which stings a bit. You can see it here compared to the size of a pen. We also use an epidural needle, which is larger than the first needle, but once the local anaesthetic has gone in, you just feel this as a sharp pressure. We put an epidural catheter, which is a plastic tube that goes through the needle, into the back, and we take the needle out. We need an epidural pump and some drugs. So the process of putting your epidural in first involves using that very small needle to put a local anaesthetic in the back, which stings a little bit. You can see it in a practice model here. Next, we put the epidural needle through the numb patch in the back that we've made for the local anaesthetic, as seen here on the practice model. Once the epidural is in the right place, we then feed this small plastic tube into the back. Sometimes you get a tingling sensation as this goes in. The needle comes out, and then we stick the small plastic tube to the back with various forms of tape and connectors. This is then stuck to up over your shoulder and has a filter connected, which stops anything going in through the plastic tube that it shouldn't. We then administer what is called a test dose, which is a small amount of medication to make sure you don't have any adverse effects, and then we give you the main dose. This will then become effective over 30 to 60 minutes, hopefully during which time you will get much happier. If you enjoyed this video, like, hit the bell icon, subscribe to my channel and leave some comments. I intend to leave more videos about pain relief and labour for your information. For more information, you can go to labourpains.com, which is a valuable resource.